Hello and welcome. I'm Dr. AI Clinical Skills, and in this explainer, we are going to absolutely master one of the most fundamental skills in orthopedics, how to take a proper history for swelling. Now, whether you're gearing up for your final exams, doing your ward rounds, or staring down an OSCE, getting this right is just so critical. A swelling is such a common complaint, but it could be anything from a simple injury to something much more serious, like an infection or even a tumor. So let's break down exactly how to approach it step by step.
First things first, I want you to burn this number into your brain. 80%. That's right. Up to 80% of your diagnosis can be made just from a really well-taken history, all before you even lay a hand on the patient or order a single X-ray. This is not just some preliminary step, it's the absolute bedrock of your entire clinical approach.
This slide here is a perfect example of a core principle you'll find in all the standard textbooks, from S- to Apley. The story the patient tells you, that's your first massive clue. So look on the left. If you hear about a rapid swelling that popped up right after an injury, your mind should immediately jump to bleeding inside the joint, hemarthrosis. But now contrast that with a slow, gradual swelling that's been developing over weeks. Well, that points you down a completely different path, doesn't it? Now you're thinking about things like infection or even a tumor. Just the timeline alone starts building that differential diagnosis for you.
Okay, so before we get into the nitty-gritty questions about the swelling itself, we need a solid foundation. Every single medical history you ever take has to follow a standard structured framework. And listen, this isn't just about making your notes look neat. It's a safety net. It makes sure you don't miss any crucial information along the way.
This right here, this is the universal structure you've got to commit to memory. You always start with the patient's particulars. Name, age, what they do for a living. Then you get their chief complaint in their own words. From there, you dive deep into the history of presenting illness, or HPI, and this is where we're going to spend most of our time on the swelling. After that, you'll cover past history, any other illnesses, any surgeries. Follow that with personal and family history, and finally, any treatment history they've had for this problem. This sequence is your blueprint for every single case.
So, now that we have our framework, let's zoom right into the HPI and get to the heart of the matter. We're going to cover the specific, high-yield questions you absolutely have to ask for any orthopedic swelling. Mastering these questions is what will make you shine in your OSCE.
First up, the timeline. This is so important. You need to establish how long have you had this swelling, and then how did it start? Was it all of a sudden, or did it just creep up on you gradually? Then you've got to ask about its progress. Is it getting bigger, smaller, or does the size seem to go up and down? The timeline is critical because, as we saw, a rapid onset points you one way towards trauma, while a chronic, slow-growing swelling makes you consider a whole different set of possibilities.
Now, pain is almost always part of the story with swelling, and you can't just ask, is it painful? You have to analyze it systematically. And the best way to do that is with a mnemonic you have to know, SOCRATES. This ensures you cover every single detail. Where is the site? What was the onset? What's its character? Is it a sharp pain, a dull ache, a throbbing pain? Does it radiate? Are there any associated symptoms? What's the time course? What makes it worse or better? Exacerbating and relieving factors. And finally, its severity, usually on a scale of 1 to 10. Using this gives you a complete, detailed picture of the patient's pain. Next, you've got to dig into the associated symptoms. These are the vital clues that really help you narrow down your list of possibilities. So you're asking, is there any fever, redness, or warmth over the area? Boom, infection is high on my list. What about morning stiffness that lasts for more than half an hour? Now I'm thinking about inflammatory arthritis. Does the joint lock up, or does it feel like it gives way? That's pointing to a mechanical issue, maybe a ligament tear. And always, always be on the lookout for red flags like unexplained weight loss or night cries, which in our setting could be a sign of tuberculosis. And this brings us to a point that's so important. You're not just treating a swelling on a chart. You're treating a person. You have to connect the medical problem to its real-world impact. Asking a simple question like, what can't you do now that you used to be able to do, tells you everything. It tells you how this problem is truly affecting their life, and that's absolutely essential for planning their management. All right, you've done the detective work, you've gathered all your clues. Now comes the part that really matters in an exam, presenting your findings. Let's look at how to structure your summary in a way that's concise, confident, and gets you maximum marks in your OSCE. And let's make this real. This table brilliantly shows how applying that framework leads you right to a probable diagnosis. Take a classic case. A 25-year-old man comes in with a swollen knee after a fall. So you ask about the onset. It was sudden, happened within hours of a motorbike accident. You use Socrates to analyze the pain. It's an aching pain, a 7 out of 10, and it gets worse when he walks. You ask about other symptoms, he says his knee feels unstable, like it gives way. See how that works? In just a few targeted questions, you're already thinking acute post-traumatic hemarthrosis with a likely ligament injury.
Okay, now here's your moment to shine in the exam. Here's how you put it all together. You want to deliver this summary confidently, in under a minute. You would say, this 25-year-old male presents with acute right knee swelling for 5 days following trauma. The swelling was sudden, progressive, and associated with moderate aching pain and instability. There are no constitutional symptoms. My provisional diagnosis is post-traumatic hemarthrosis, possibly with an underlying ligament injury. See? Polished, professional, and straight to the point. That's what will impress your examiner.
Finally, let's cover the small details that make a huge difference. These are the little tips and common pitfalls that, if you get them right, really show your examiner that you're thinking like a seasoned clinician, not just a student memorizing a checklist. So let's look at some common mistakes versus some real pro moves. A big mistake is forgetting to specifically ask about a rapid versus slow onset. It's a key distinguishing point. Another is skipping questions on functional disability. Now, the pro move? Always ask that golden question, what can't you do now? And this is absolutely crucial. In the Indian context, for any chronic swelling, you must ask about any history of contact with tuberculosis. Avoiding these simple mistakes and using these tips will really elevate your history taking. And there you have it, a complete, structured framework for taking a killer history for any orthopedic swelling. You've mastered the asking part, so what's next? In our next explainer, we're going to move on to the looking and feeling part, the physical examination of a swelling. We'll walk through exactly how to do it for your OSCE cases. Now, if you have any questions at all about today's topic, please drop them in the comments below. And remember, the key is practice. Do this in the wards every single day, and you will master it in no time.